Welcome, everyone, to today's webinar, More Than Bottom Line Impact, How RCM Outsourcing Can Improve Employee Engagement. On behalf of Becker's Healthcare, I'm Assistant Editor Giles Bruce. Welcome, and thank you for joining us. Before we begin, I'm going to walk through a few quick housekeeping instructions. If you have any questions throughout today's webinar, you can type those into the Q&A box you see on your screen. You will find a few engagement tools on your dashboard. Please check out our resources section and also make sure you fill out our session survey. We will have 2 poll questions during today's webinar. When we get to the poll, the question will pop up in your slides box and you can submit your answer directly on the screen. Thank you in advance for your participation. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access that recording. Lastly, if at any time you have trouble with the audio or video, please try refreshing your browser. You can also submit any technical questions into the Q&A box. We are here to help. At this time, it is my pleasure to turn the floor over to Shannon White for a few introductions and to begin today's presentation. Thank you, Shannon.
Thank you so much, and good afternoon, good morning, wherever you're calling in from today, whatever time of day it is where you reside. We're thankful that you chose to attend our session today. We have some very exciting guests with us, and quickly I'll just introduce myself. I serve as the Chief Operating Officer for Ensemble Health Partners. Ensemble Health Partners was founded in 2014. Today we serve greater than 9,400 associates across our enterprise. We serve 21 full outsourced customers that is typically over 300 hospitals within the industry and what we refer to as full end-to-end revenue cycle outsourcing. That represents about $26 billion in NPR that we manage annually, and I certainly could not do that without solid HR support. And with that, I'm going to introduce our first special guest, Mr. Ryan Brown, and allow him to tell you a little bit about himself.
Thanks, Shannon. Good afternoon, everybody. I'm so grateful to be here with all of you today and with this panel, and looking forward to share some information with you this afternoon or this morning. I've been with Ensemble for a couple of years, about to celebrate my 2-year anniversary, and I lead our talent teams here at the Ensemble organization. I come from a background of retail, technology, and finance, in addition to healthcare, and I'm joining you today from the great state of Texas. So glad to be here with you and looking forward to share some information. Carolyn, what about you?
Hi, good morning, good afternoon. I'm Carolyn Schneider. I am the Chief Human Resources Officer for Ardent Health Services. I've been here about the same amount of time Ryan's been at Ensemble, just about 2 years. I come from a long background in healthcare. I've been in healthcare, most of my life, both on the provider side as well as actually the technology side. I've done both, and it's been an exciting time to be here at Ardent. And we recently transitioned our revenue cycle to Ensemble last year, so it's been a wonderful experience so far. So thank you very much. Mark?
This is Mark Nance. I'm the President and CEO of Valley Health System in Northern Virginia. I took this job on March the 6th, 2020, right before the world shut down. So I've been CEO for 3 years. Prior to that, I spent a dozen years at Bon Secours Mercy Health System, and previous to that, 20 years at what is now Atrium Health. Background as I came through the Chief Financial Officer ranks to get to CEO, so pretty familiar with revenue cycle management, both running it and now in an outsourced situation. And we converted over to Ensemble on January the 1st of this year.
Yeah, thank you, Mark and Carolyn. We're going to hear more from you in just a moment, and I'm super happy to have 2 of our clients representing on today's call, because we're going to talk about something that's near and dear to our hearts and especially to our providers' hearts, which is the associate engagement, and kind of give you some, 5 thoughts that we have on how, through a transition, through an integration, through even an outsourcing, you can actually improve associate, i.e. employee engagement. And collectively, I think we have some really robust advice to provide you today. But where does it start? It starts with the initial thought of thinking, do I need to look at outsourcing? Do I need to look at having some type of large transition? And honestly, what we see in the industry is that starts from a variety of pressure that's happening to our facilities and our provider offices. I'll just give you some stats just to make sure that you understand what I'm talking about. Increasing payment complexity. Last year, we saw a record-breaking stat in the month of December. We saw 2.3% of total claims being billed out actually being retracted. This was the highest stat that we've seen come out of payer behavior since 2019, prior to COVID. And so what do we know through that? We know that our payers, frankly, are having trouble keeping up with the adjudication of claims. The pressure on them for turning that adjudication window around on the clean claims that we're submitting is enormous for them. They also lost a lot of their resources during the COVID time period. And so all of that being said, we see a gravitation with our payer population to more aggressive behavior, more investment in AI on how they can claw back payments from the providers that we service. We're also seeing wage increases. This is not new news to any hospital system out there. I'm going to invite Mark back up in just a moment to recognize maybe something I'm saying here. Arching, though, overall, we've seen labor expenses in our hospitals increase by 17% prior to when COVID hit, a 17% increase on the wage SWB for our hospitals. Mark, would you like to share anything from Valley Health in regards to wage increases?
Yeah, I think our wage increases for our existing employees, the ones that we're trying to keep that are Valley Health employees, has been over 20% for us since the beginning of the pandemic. And that included a variety of bonuses, paying people not to work, increased wages, just minimum wage increases. If you really add in our total cost of labor, when you add in the temporary and agency rates and the amounts that were required for us to go out and find in the market, the increase for us from the beginning of the pandemic to the end was over 30%.
Wow, that's incredible, Mark. Thanks for sharing that. So when you think about pressure such as that, where does it lead to? It leads to 92% of hospital leaders thinking or saying out loud that they're considering outsourcing clinical and non-clinical functions to allow them to focus on priorities of improving patient care. We saw that in a recent report from Black Book. If you've not checked out that report, I encourage the audience to check out the full report on how our hospital and integrated healthcare delivery systems are thinking about outsourcing. So how can RCM outsourcing, narrowing in on RCM, and especially the reason that Ensemble wanted two of their clients to speak to it today, how can we think about that helping with these pressures? Certainly having subject matter expertise to stay ahead of the ever-changing payer concerns that are out there. Being able to place an considerable more amount of educated bandwidth on specific payer issues. Being able to dedicate the administrative workforce that's needed to manage these. Also being able to look to an outsourcing RCM provider that can help foster and facilitate growth for revenue cycle leadership. I'm not aware of any associates that want to feel like they're, quote, landlocked, or they're in an atmosphere where they can't grow further. I typically find in the RCM field that associates want to continue and desire to continue to build on their RCM knowledge, and being able to create an awareness of a multifaceted group across many states in their industry is a certain kind of special when you think about revenue cycle outsourcing. I think oftentimes what I hear is, Shannon, what about the impact of outsourcing to the associates? I care about my people. I care about the community that I serve. I certainly don't want to see a downward trend in associate morale, and I certainly don't want to see a loss of economic development within the communities that I serve. And today, I think that's where we're really going to be able to offer you some powerful insights. But before we do that, one of the things that I would like to do is a poll really quick with you as the audience. How many of you, and Ryan, if I could get you to advance the slide for me, thank you. How many of you have went through a significant transition or a significant outsourcing that involved associates? If you could answer that for us real quickly, I'd like just to understand our audience that's on with us today. Wow, almost 62% of you have gone through some type of large transition. And I'm sure if I were to extend that poll and say, were those transitions positive? Were they negative? What's your perception of transitions? I'm sure that you would have something major to share with me, and you may say a little bit of both. But real quickly, I'd like to bring our special guests, our clients, back up to the speaking here and say, Carolyn, if we could start with you. In your numerous years as a chief people officer, chief human resource officer, I'm sure you've seen a lot of large transitions. Can you just share a little bit of what your feelings are on transitions, large outsourcing, and the impact on associates?
Thank you, Shannon. Yes, I would say I have been through many transitions in the past, and large and small. And as we think about the future of healthcare, expect to be, continuing down that path as we evolve in our world right now. I'd say that the experience that we had with Ensemble was very positive, and it was very intentional. I think the team did a great job of preparing for the transition, and our employees themselves were a little nervous. I mean, that's to be expected. But as we move forward, they really started to enroll in the idea that they were going to go to a bigger and better opportunity for them if they wanted to stay in RevCycle.
That's great, Carolyn. Thank you for sharing. Mark, any thoughts on previous transitions or large integrations you've done throughout your career?
Yeah, I mean, I've been through two significant mergers where my organization was the one being merged into the other. And then, like everybody probably, I've done dietary, environmental, and biomed. I would say that because of the order of magnitude of our Ensemble transition, it was more like a merger process than it was, outsourcing a small department like dietary, environmental, or biomed. So it was a bigger undertaking. It wasn't quite a merger, but a much bigger undertaking. The first time I did a merger, it was the first time I did a merger, so it was bumpy. The second time, I at least had a little bit better understanding that things were going to be bumpy, so my expectations were set a little bit lower, and we exceeded them. But I would tell you that our transition, which is still fairly new, it's 2.5 months ago, almost 3 months ago, has gone about as smooth as it possibly could, particularly for close to 400 employees, many of them very long tenured. It was clear to me that practice makes perfect, and I think that Ensemble has done this so many times. The process has been refined, not perfect, but it's been refined to the point. And Shannon, I guess you might say it better than me, but you've probably made every mistake there is to make, and learned from everyone, and learned from every one of them. And that's what I felt, and what my employees felt, and executive team, was that we were dealing with a partner that's pretty good at this, and a partner that clearly values the people. I think we only had about 10% attrition, and most of that was retirement. And I don't know what the statistics are, but I can't imagine doing a whole lot better than that in terms of preserving 90% of the workforce.
Yeah, and I would just, if I can jump in here, I'm going to say, I believe we had like 94%, 95% of the people that were offered positions went with Ensemble. So it was a really great opportunity for them as well.
Yeah, Carolyn, thank you for that. Mark, thank you. Appreciate the kind words. I would say that, Mark, you're exactly right. A lot of the thoughtfulness and preparedness that Ensemble puts in the transition is centered around the people, twofold. One is, I think it actually starts from the origination of how we were founded. I myself have been through 9 associate transitions as a revenue cycle operator, and part of that development within Ensemble is the lessons learned of things that maybe didn't go so well in my experiences. And I would say predominantly these 5 considerations that we're going to share with you today, I think are part of the large magic behind that success. To Mark's point, there will always typically be some minor bumps, but I think when you stay focused on the people, their emotions, what they're walking through, the natural instinct of the questions that you have, and I think starting out with this first one, which is getting behind the big why. I think it's tragic if the associates feel like they failed in some way. What we see within the industry is a lot of great revenue cycle talent. And so part of our ambition, if you will, with Ensemble is to retain as much solid revenue cycle talent as we can within the industry and continue to develop it. But this is really about Mark and Carolyn. And so when I think about getting behind the big why, right, explaining why the change is happening, how it's positive for everyone involved, and making sure that the revenue cycle leadership is engaged and understands the why, as well as the facility leadership and ops or SG&A and understands the why. But maybe, Carolyn, if we could start with you and just talk about your approach to helping people get behind the big why.
Yes, we've got a fairly transparent leadership team here. And so we talk about a lot of things, particularly with purpose and the reason behind things. And when we thought about and announced the Ensemble transition, we really wanted to focus on the fact that these people, our teams have been with us for so long, and they're not really going away. We still get to work together, and we still get to, be side by side in many respects. And so it was for us more so overcoming, what people imagine might happen. And so as we went through the process, I would say that for us, we created a communication hub so that all of our team members could go there and learn more about the why and the process as well. And I think when we quickly scheduled meetings for Ensemble to be on the ground, talking to our people and talking to our leaders, and we were arm in arm with them. And so when that happened, again, people began to feel a little more comfortable. And I'll have to, give kudos to Ensemble because they got around the country. We were in 6 different states and have 30 different, we have 200 sites of care, but 30 different facilities. And they got on planes and they were quickly scheduling meetings with our team so that they could allay the fears that people might have and also explain, what's in it for them.
Thank you, Carolyn. Mark, thoughts to share on how to get folks and how you got folks behind the big why?
Yeah, I think, again, mentioning I came from a CFO background, my experience is in an organization, in almost any healthcare organization, revenue cycle is usually not the big sexy thing that gets a lot of investment, particularly when it comes to technology, people, process, and technology. It's always collect as much as you can, as cheaply as you can. In the age of electronic health records, customer relationship management systems, enterprise resource planning systems, those are the big things that get a lot of attention of the IT departments. And I would tell you that at Valley Health, we just hadn't invested in people, process, or technology in our revenue cycle area. And I think that a lot of my revenue cycle management people, patient access people, coding, those folks, they felt that lack of investment. And in some ways, we're probably at least discouraged, but maybe even resigned to the fact that they were going to be, fighting without the appropriate tools. And I would tell you that my revenue cycle people, particularly leadership, felt like they were not equipped to go toe-to-toe with Anthem and United and all of the technology and all of the people and all the processes. And so, I kind of hit on that. And my message was, I think we can do better. And pretty much across the board, all of them felt like we could do better too. And then it became a conversation of, do we have enough resources to be proficient at this, to be excellent at this, like we are at heart surgery and other things, or do we think we need a partner? And so I worked with the leadership of revenue cycle management for about 6 months to a year before we got to the place where we all agreed that we probably we're a fairly small system at 1.2 billion, but we got big system needs. And our deal was we want to be independent and self-determining for our clinical services and what we do in our community, but maybe we don't need to be that way for some of our back office functions. And so we kind of landed on that together, and that became our big why. Is that we wanted our ability to, one of our values is excellence. And in our situation, we didn't feel like we could be excellent unless we got some outside help. So that's one of the big whys. And then obviously, unlock the potential in the revenue cycle and collect, another 2 or 3%. That was a big why as well. And then the last thing I think we emphasized to the folks on the team was, right now your overhead for this company, you're a cost, because we're a healthcare company, we deliver care, you're a cost. And you're going into a company where you are the revenue producer. The company collects revenue. And that's, so you've gone from the overhead side of the business to the revenue producing side of the business. And we felt like there was a lot of opportunities for people that they wouldn't get here. The career path here is relatively limited. Being in an organization of 9,800 folks that are revenue cycle people, we emphasized the fact that we thought there'd be a lot of opportunity. So I could say more, but I'll stop there and just kind of leave that with you on our big why and how we communicated.
Yeah, Mark, that was great. Carolyn, thank you. So consideration number 1, folks, get behind the big why and make sure that you have an aligned approach to the big why. I think that's going to feed next into our next consideration, which is thoughtfully communicate the change. And with this one, I'm going to invite Mr. Ryan Brown back up to the audio here. Ryan, we spend a great deal of time, our marketing teams, our HR teams, working with our client counterpart teams in those same areas on a robust communication plan. And before I roll it to you, I want to make sure that I caveat on what Carolyn and Mark just said. You heard the way that they look at it and how they're communicating the why to their associates. I want to make sure you understand at the same time, they're inviting us to the table. I mean, same day of the announcement, Ensemble is present. We then get to communicate the why from the Ensemble perspective. And one of the biggest whys that I communicate is, I need you. I want you as a part of the team. I value your experience. I value your tenure. And so, Ryan, with that being said, can you spend a little bit talking about the purposeful actions around the thoughtful communication plan and rollout and following that?
Absolutely. So as Shannon, Carolyn, and the team mentioned, this is really a partnership. We're still working with both sides, post-integration with the client. And so what we want to do as quickly as we possibly can is really get in front of our associates and make sure that they understand the person, behind the organization. And so we do that really carefully by working with our partners to understand, what has made up this organization's culture. What is the main concern? What are these associates passionate about? And what's top of mind for them? If we can understand kind of what's on their minds, and we can quickly address those concerns, let them get to know us a little bit better, and really, show them what that ensemble difference looks like. And we do that through several different avenues. Like Carolyn had mentioned, we stand up a site to really make sure that our associates have a central point of contact to pull information at real time based on when they have those questions. We make sure that we're equipping leaders before the transition, during the transition, and after the transition, both on the client side as well as on the ensemble side. So everybody has access to the communication to support the most important thing during the transition, the associate. We're also, taking feedback from the associates and from our partners all through the process to where we're able to really focus in on the most important things for the associate and those topics. And what we do with that is we set up a series of live forums where we have all associates invited and participating in topics most important to them. And they can ask questions about, what's on top of their mind? What is their benefits going to look like? Can I still take that PTO day that I had planned? And really just kind of engage with us and get to know us. And then probably the most important thing is really being able to give them some time, some one-on-one time with their leaders to where they're able to ask some of those real specific questions about their job and what that's going to look like. Are there differences? And really kind of start building that trust and that relationships with the leader. And that kind of takes them to the onboarding phase after the transition, which is, getting to know the company that is Ensemble, what those unique benefits are that we are able to offer, and how they can grow with us, most importantly, so they can continue that career journey and not have a bump along that road. So those are just a couple of things that we do along the way, Shannon. Any other thoughts that you would offer, Carolyn or Shannon, in terms of the process that you've observed?
Brian, you guys did such a great job with that. Like I said, I can't say enough the good things, especially about the in-person meetings that you guys did. It was very thoughtful and very meaningful to the team members. They could start seeing themselves, I think, as sort of starting that vision of what it would be like to work in this environment.
Yeah, thank you, Carolyn, and Ron, thank you for your valuable insight. I think that rolls us nicely into number 3. And I'm gonna talk about number 3, which is addressing what matters most. Ron, you touched on this, but I'm also gonna talk about this one in relation to a question that came through from the audience, which is, how do you overcome negative reactions to the initial announcement? And here's what I would tell you from my aspect, and then I'm again going to roll it to Carolyn and Ryan and Mark to see what they have to add. Having done now 8,000 associate integrations through Ensemble Plus, I would just tell you that there are a certain amount of negative reactions, and it typically comes from the fear, and it typically happens at the moment in time that the announcement's being made. And from my aspect, having partners that are inviting me to participate in that realness and rawness as it's happening allows me then to really understand what matters most to that particular associate at that moment, which is, are they scared because they want to understand, first of all, is it as simple as something as I had a vacation plan next week, can I now take it? Is it as something as simple as, am I going to have a job? Am I going to be able to provide for my family? Trying to make sure that we just very candidly and very frankly within that next 10-minute window say, these are the things that we believe matters most to you as a collective group. We recognize that there may be individual things from some of you specific, and we're here. We're here to answer those individual items, and we will be hosting Friday forums, as Ryan mentioned, et cetera. But when we think about addressing what matters most, and when we think about some of the negativity that can come out upon initial reaction, I would like to really invite, Mark, let's start with you. As the CEO of a large organization, I'm sure that you hear from associates quite frequently, and certainly that can weigh on you. So when you think about negativity or you think about what matters most, what have you seen as success in addressing that quickly?
Well, I mean, I think the first thing that you got to understand is nobody likes change, and everybody immediately goes to what does this mean for me? So you know, the idea that this is gonna be awesome and everybody's gonna hear everything you're saying, you just got to realize they're not going to hear it the first time. They're probably not going to hear it the second time. They might see some benefit the third time they hear it, and then it starts to sink in. So you know, we made sure we communicated over and over and over. You know, we did that in concert, Shannon, with you all. But you know, for me, I come from a ministry leadership background in faith-based healthcare, and so we really care about the person. And a lot of these are our lower paid people. So, you know, we made it, you know, very much a system-wide leadership initiative that, hey, we need to be there with these people because they're going to experience a sense of loss. And it's okay that they get mad, and it's okay that they're not going to, you know, people just aren't going to be excited about hearing this. Very few people are. And for us to get frustrated and try to convince them that this was a good thing for us is, you know, for them was not something we were going to try to do. We were just going to really kind of be with them at first and let it sink in. And I think that kind of validating the way they were feeling, giving them some time to do that, reassuring them of their most worrisome fears, which is, am I going to have a job? Am I going to lose my benefits? Am I going to have to move? We hit the big existential questions quickly, and then we gave them some time to let that sink in, and then we began a steady drumbeat of communication. And I think that was something that the 8,000 transitions that you all have done, Shannon and Ryan, I think that's where that really came in. I will tell you, did I get some angry, you know, emails? Did I get some angry, upset, anonymous letters? I did, but at the same time, I'll give you this as an example. At the same time, I was eliminating 5 fitness centers in several of our rural markets. The total number of employees in those fitness centers in those rural markets was about 40. The total number of employees with Ensemble was about 400. And I got more nasty comments, notes, and letters from the 40 at the same time than I did from the folks at Ensemble. and I think that the folks who transition to Ensemble. So I think the learning in that is potentially that maybe we just suck at it and Ensemble's good at it, but I think that the message in that is you can't really do it much better than that. The other thing I'll tell you is I have a bird's eye view of this transition because I ride the elevator every morning with the patient financial services people. They're in my building. And just because we partner our revenue cycle with Ensemble did not mean they left the building. And, this might be a low bar, but at no time did I feel threatened by the people in the elevator with me in the weeks that followed. And I still ride the elevator with them today, and I ask them, how's it going? And they tell me the good and the bad, but it's mostly good. And most of the awful things they thought might happen have not happened. And most of the good things that we told them that were going to happen have happened. So that's been our experience.
Mark, thank you. You're making me laugh over here, but so very true. Carolyn, you have anything that you would like to add about addressing what matters most and maybe how Ardent looked at the negativity, if negativity was present, which I'm sure there was some considering the vast amount of the workforce, how you looked at that and how you viewed that?
Right. So what we really try to do, because I think what most people, to Mark's, statement, I mean, you have to address the existential questions first, but then it gets into, I already had surgery. I've already met my deductibles. I've already done this. And so people want to understand how that impacts them going forward. And I think we did a really nice job of not only looking at benefit side by sides and, time off policies, and what are the differences? What are the benefits? But also thinking about things like accumulator files, right? And making sure we tried to keep people as whole as possible so that those kinds of concerns were addressed very quickly. But I think we've got to be able to put ourselves in our team members' shoes and say, if I'm them, what's going through my head right now? And how do I need to be prepared to respond to those questions? And, to your point, Mark, and to your Shannon, I mean, it wasn't all, roses and chocolate. I'm going to tell you, there were some difficult moments, but I think, change is hard, right? And change is hard for everyone. And we just really have to try to be respectful and, and care for our people as much as we possibly can, and knowing that they're going through a lot of swirl, I think is the best way that I can put it. But things we are probably, I think the last transition I'm trying to recall was that maybe in the end of the summer last year. And, I think in hindsight, we're looking back, there are lessons to learn from our side as well. And, but overall, I look back and I think things are going really well. They're very, very smooth, and we hear good things coming out of the groups that have migrated to Ensemble.
Well, thank you, Carolyn. That helps move us forward to number 4. So we talked about addressing what matters most, and I think this one is without a doubt one of the most pivotal, which is making the associates feel welcome. I think oftentimes the associates, and Mark, you hit on this, are afraid that they're going to lose the culture that they have been a part of for 20 plus years, 30 plus years. Especially we see this with associates in faith-based ministry systems. A big part of making them feel welcome is beginning to show them how our cultures blend nicely together and how the two cultures have to thrive together. Not that they're being expected to abandon the culture that they've walked away or that they're being integrated from. At the client site. And we do that in a variety of ways. Ryan, I'm going to invite you to share more here, because I know that you're instrumental to bringing this to life with us from an HR perspective. But we do a lot of welcoming and a lot of, and when I say welcoming, the pictures show fun and engagement and making them feel important. And that's all true. But I also want to make sure that I'm not remiss if I didn't tell you, we're being very candid with them in regards to, we're going to be taking you on a journey. And on a journey of sometimes is going to involve changing your job role, teaching you a different way of doing things. Sometimes that journey is going to make sure that you understand that there is a certain amount of productivity and quality measurement that has to be in what you do each day, and you should want that to feel proud of what you're doing each day. And so it's really a journey and really a welcoming that helps them understand what to expect next. And so, Ryan, I'm going to turn that over to you, because you are instrumental to helping us cascade that welcome to Ensemble.
Absolutely. And I'll tell you, everyone, this is probably, one of the greatest parts of our role, right, is really being able to welcome, new members to the family, if you will. They've heard us talk. They've seen us. They've read different documents about us probably at this point. But this is the chance that we get the opportunity to really make them feel what it means to be a part of that ensemble difference. A couple of pictures on the slide, like Shannon mentioned, show a little bit of the events where we celebrate that day one experience to get them really excited about the organization that they've just become a part of. But, that's just one of the aspects, like Shannon mentioned. There's lots of things that we're doing from an organization to really help model the way of what it means to be, a part of Ensemble. And that starts with our leaders as well, which is, very quickly establishing those routines with our associates to where they've got that one-on-one time to really hear what's most important to them and start really modeling the way in terms of what we mean by supporting our associates, what our culture really looks like in terms of the programs that we offer our folks. We do that through, one-on-one conversations of dedicated time with every associate across the organization. Leaders do town halls where they're able to invite their associates to come and hear news, coming across the organization and plan for what's coming down the road, and also get to interact and engage with one another. We celebrate our associates through holidays and events where we bring folks together virtually to really have a lot of fun together, to recognize the diversity that what makes up our organization, our culture. And every year we have one very, very exciting conference called our EDGE Conference, where we invite all of our associates together to really focus on development, get to know the leadership team a little bit differently with an open panel of Q&A questions, and really just focus on them for that day. Once a year, which is fantastic. So just a couple of examples of how we try to step off of the page and really get to know the organization for what it truly is, and that's the Ensemble difference. One of the things that I want to share with. Oh, go ahead.
No, Ron. Sorry, you go ahead and share.
Sure. One of the things that I wanted to share with folks is during our Arden transition. We were not quite through that transition yet, but we heard of just a tragic situation at one of our associates that was going to be coming over, and there was a death that had taken place, and one of our leaders on the Ensemble side, reached out to Arden. We were devastated to hear the news, and together with our Arden partners, we created an opportunity for our associates to come together and really celebrate the life of someone that was taken too short. And it was a great opportunity for folks to really get to know the Ensemble leaders, to let them know that we care and what we could do to help support them. And, going back to Carolyn and Mark's point, and these are associates that are really, getting love from two different areas at that point. And it was just a great example of how we could lean in to really support our folks. Even though they hadn't fully transitioned, we wanted them to know that we care, and we were looking forward to supporting them.
Yeah, thank you, Ryan. Such a great example of who we are just as Ensemble. And, I think that leads nicely into our last consideration that we have for you today, which is how do you continue the momentum? And this one is easy for me to talk about because it's who we are as a company, which is every day we feel like there is value in touching the lives of others, and we try every day, strive for intensely to walk in people's first, last, and always, which is our number one Ensemble difference principle. And for the most part, we believe that we're successful at that. So the momentum is easy for us because they begin to feel the wraparound support on a daily basis. And more importantly, I think the difference that they feel, and this is not being critical of the integrated healthcare delivery systems at all, because their primary focus is on patient care. Our primary focus as Ensemble is delivering the best revenue cycle results. And so our primary focus is on exactly what those associates are doing each day. And therefore that the momentum of keeping them engaged becomes, as we call it, the journey. And for us, right, we're taking a readiness survey. We're saying, have we communicated enough with you for the crossover integration? Are you feeling that you have the information that you need? We're doing very intense focus with the leaders. I myself am sitting down with the leaders on the team that's integrating in and helping them understand some of the differences that they're going to see within the Ensemble atmosphere, especially around revenue cycle. But I'm also seeking their input. Again, we very much believe that we receive a lot of talent through our integrations. Pretty much they know what needs to be improved. They have a very real aspect and firsthand view on what are the actions that need to occur. And then we do a 60-day post-integration survey to make sure that we're doing a pulse check on how the associates and the leaders are feeling. And then we also do an annual, what we call Speak Up survey for all of our associates, in which we keep a constant pulse check on how folks are feeling about our engagement, our education, and just our overall culture within Ensemble. And so if I could just leave you with one last slide in regards to, before we do our summary and open up for questions, I think what's important, Ryan, if we could advance to the next slide here, I think what's important is to hear from some of the associates. And we have so many of these, but we chose one in admiration for one of our clients attending with us today. This was an actual comment that came through that we're pretty proud of. You can see here, I'm not going to read that. And then on the right side, I just want to point out that 70% of the leadership within Ensemble as of the end of February is from integration. And we couldn't be more proud of that. So when I'm asked, what's your secret sauce, Shannon? I always say it's our people, because it truly is. And this is an example. Allison came to us with one of our client integrations, and just the rapid growth that is available for someone that may have not had that opportunity within the client space to become, in Allison's example, an AVP of CDI in less than 4 years. And, I love this quote from Allison, which is, there would be no other place that I would have such opportunity. Ryan, anything you want to add to that before we do the summary real quick?
I think you hit it well, Shannon, is making sure that our associates know that we want to support them, for them, to keep them on that journey is one of the most important things to us. I think Allison's such a great example of that.
So real quickly before we roll it, please, I'm asking for you to light up the Q&A if you have any questions. We've got a lot of great folks on here with us that are more than happy to answer in the time that we have left with you. And while we're hopefully getting some questions in the Q&A, let me just recount for you the 5 key takeaways that we want you to think about when you think about doing a large transition or an outsourcing that we believe are instrumental to making sure you actually improve your associate engagement. And we believe that if you improve your associate engagement, you in turn will improve the results that you're looking for. So number 1, get behind the big why. Focus on it from the associate level. They're going to want to understand the why from their perspective. Number 2, thoughtfully communicate the change. Make sure that you have a very robust and a very hands-on communication plan that is between both organizations. Address what matters most. As simple as it sounds, get in front of the, do I still have a job? Be able to answer that readily and have that available for the associates being impacted. Make them feel welcome, right? Begin to help them understand how they're going to not lose the culture that they've had and that they, as Mark mentioned, a lot of long tenure, long-term associates, and how we're just, the entity is adding to that. And I guess I would be remiss here to say, make sure you're partnering with someone that you believe shares your same values and your same culture and same investment regarding the people. I think that's key there, else you may get more negativity than you actually anticipated that you would. And then lastly, continue the momentum. It's a journey, and it has to be an everyday. No one wants just cake for their birthday. They want to feel special, feel valued, and feel seen every day in their experience with an organization that they're a part of. And so with that being said, I would ask, do we have any questions that myself or Mark, Carolyn, or Ryan can answer?
Okay, yeah, this is Giles Bruce again with Becker's. I'm going to open it up for the Q&A portion now. Again, I wanted to thank Ryan, Shannon, Carolyn, and Mark for an insightful presentation. For our webinar attendees, please feel free to enter any questions into the Q&A box at the bottom of your screen. If we're not able to address your question in the time remaining, we're happy to follow up with you offline. Let me go to a question here. I'll leave it up to you who'd like to jump in on these, but we have a question from Kara. How did your patients react to all this?
Oh, I think that's a good one for Mark. Mark?
I need to get off mute. I'm sorry. You're referring to the question of how did your patients react?
Yes, sir.
Yes.
Yeah. We have not, we've not had any, it's been seamless for the patient. And Ensemble took over, you took over scheduling, pre-auth, pretty much a ton of our patient financial services interactions with the patients. We've not seen or felt any more actually we've had less complaints about billing, but it's only been 3 months. So I'm not going to give all that credit. It could just be that we were doing okay. But our patients, it's been seamless to them. Same from our physician practices and offices who work with them. We have not seen any increase or problems develop as a result of the fact that our Ensemble partners are now patient facing.
Great. And we have a question here directed for Shannon. Joseph wanted some clarification on how this all works. CS, does Ensemble take over the revenue cycle personnel from the hospital client, and what are the main advantages for the hospital?
Oh, that's a great question. So yes, My apologies. We are a full end-to-end revenue cycle outsourcing partner. And so with both of these clients, our scope is everything from registration through zero balance on the account. Our model in that is to take the associates and move them from the client's payroll to the ensemble payroll. And so we put intense work into making sure that we understand what associates are doing what scope of work. We do that in coordination with the HR department. So as an example with Carolyn and Carolyn's team in Ardent, to make sure that we understand who on the payroll is doing the revenue cycle function. And then repeat that second part of the question for me. What's the benefit to the hospital? Was that what I heard?
Yeah, what are the main advantages for the hospital, correct?
Yeah, I'm wondering if that's in reference to just the sheer movement or just why outsource as a whole. And so I'll answer it both ways as quick as I can, because that one is really a robust question. The benefits for the hospital, and Mark or Carolyn, love for you to jump in here. First of all, we're able to focus full-time on the revenue cycle for the integrated healthcare delivery system. And we are doing acute and we're doing physician. Therefore, we're delivering top revenue cycle results, oftentimes having a very solid impact on the hospital's net revenue per adjusted admission through what we call net revenue lift. And you may be thinking, well, Shannon, how do you do that? Let me just give you a couple examples for my fellow revenue cycle folks on the call. We do it through a variety of ways, and we do it at the account level. But as an example, underpayments, where clients have not been paid according to what their contracts say by a payer. Reducing fatal denial rates. How can we improve the appeal process? We use a variety of attorneys and nurses, and we're exhausting appeals at the top level, even using external appeal. And I could go on, but that's how we do net revenue lift. Balance sheet would be the cash flow. How do we make sure that we have skilled revenue cycle operations, making sure that we're pushing through all billing edits, resolving same day, making sure that we're holding payers accountable for proper adjudication, making sure that miscellaneous information. I think Mark would tell you we've also been instrumental with payer communications and taking on some of the rigidness and some of the disruption that we're seeing in the payers right now. So all of that is the benefit. I would say moving the associates to our payroll allows the hospital to know that they have someone in one place focusing on revenue cycle results and also focusing on the well-being of those associates. But Mark, I would invite you if you have anything to add to that I didn't communicate.
Yeah, I think you did a good job. I think I'll say it a different way too. I mean, the expectation in my experience is a 3% revenue cycle lift. Whatever numbers in revenue you are, I mean, our expectation is a $36 million lift to the net revenue cycle. I think we achieve scale. Again, I'm predisposed because I'm a recovering CFO. But I've never seen a revenue cycle in 35 years that was under $1 billion in this day and age, in this tech-heavy age, that is a big enough scale to deliver what one that's collecting for $30 billion is. It is just getting the level of resources, investing in the technology. So it gives us the ability to achieve scale and to maximize our revenue collections, maximize our contracts, manage our contracts, our denials with subject matter experts from all over the country working from our ensemble that there's no way I could have access to in the southern Shenandoah Valley of rural Virginia. So it's going to add to my bottom line. It's going to increase my capabilities. It's going to allow me to stay up to date with technology and to have the tools I need to have a fair fight with Anthem, United, Cigna, Aetna, and the rest of the folks that we have to deal with on a day-to-day basis.
Thank you, Mark.
Great. Thank you for answering those audience questions. That is all the time we have for today. I want to thank Shannon White, Ryan Brown, Carolyn Schneider, and Mark Nance for an excellent discussion, and also to Ensemble Health Partners for sponsoring today's webinar. Thank you again for joining us today, and we hope to see you at future Becker's webinars.